Hi everybody, I've got Christy with me and I just wanted to show you some very quick things about sitting. Um, Now lots of people have labral tears and these are very common in people and just because you have a labral tear doesn't mean you're going to have pain, but sometimes you do have pain with a labral tear and sitting can aggravate it or flexion positions. Now I've got Christy here sitting in a very nice position. You can see that she's got a gentle lordosis in her lumbar spine here, and you can see that her torso is over her hips, and her feet are placed nicely, and her knees are underneath her hips. So she's got a downward slope of her femur. All of this is relatively good. However, if you're sitting like this, and Christy, can you put your fingers in your hip flexors for me, please? So if you're sitting like this, you can actually see if the hip flexors are turned on or off. How are they going, Christy?
They're off.
They're off, okay? Now this can actually be a position that still compresses the anterior part of the joint and give you labral pain. Now, if I told Christy to sit like she does when she does have anterior hip pain, can you just sit what feels the most comfortable for you, please, Christy?
What feels the most comfortable?
Yeah, you know when you slouch it out? Okay. Now, a lot of you may be gasping that such a bad posture is bad for you, but if Christy bends her elbow, her right elbow out of the way, we'll see, yep, you'll see that her torso is laying back and she's now opened up to something like a 120-degree angle right through here. And the reason, maybe even 135, and the reason why this is a good position for her is that it's no longer pinching the front of her hip. So I actually will allow patients to slouch like this. Or if Christy just scooted her bottom back into the chair a little bit and sat up against that backrest, let's just try that. Again, that is allowing her to keep an open hip through here and not compress the front of the hip. I'll get you sitting up into a bolt upright position for me, please, Christy. So in this sort of position here, lots of people would love to have, just give me a little bit more anterior tilt and sit taller, sit taller. So even though we can't see her torso, um, her upper body, I mean, just extend backwards a little bit for me, Christy. Yeah. I see some, yeah, that's it there. I see some people trying to sit like this in everyday life. And they really put this anterior tilt through here and they close this angle to less than 90 degrees. And that's going to put lots of pressure in the front here. Now, another way that you can sit, and Christy already uses this strategy, is to drop your right knee down so that you open up the angle of that hip. So sometimes if you're sitting on the chair, you can sit on the edge of it and doing that will open up the hip as well and will allow you to work without pain. Um, One of the other things that may help is sitting normally again, Christy, is what we call wide base sitting. So what you can do is you can grab the inside of the ischial tuberosity. So you start on one side and you're going to pull it out and back like so, and then sit the other one out and back. And this widens your base of support. It's going to decrease the amount of muscular activity that you need to sit. And then Christy, if you just monitor in the video screen there, I just want you to flatten out that lordosis for me a little bit with a posterior tilt. Yep, that's it. So just a little bit of a slouch opens up the hip and can take away some of that pain and that compression pain. So it's all about working with what you have. No posture, no matter how photographically perfect it looks, should be sustained for a long time. Our bodies are designed to move, they're not designed to sit. I've been teaching variations of posture for ages, and now, sitting is the new smoking is trendy. It's cool. But, physios have been promoting this for a long time. So there is no one perfect posture. Get into the position that helps you and change it regularly. If you're in pain, you may have to change every 5, 10, 15 minutes. If you don't have any symptoms at all, you should be changing at least every 30 minutes your posture. And that could be as simple as just sitting back, sitting forward, standing up. Go for a walk for a minute. It should just be changing. You shouldn't be sustaining the one position. Okay, hope you found that useful. Thank you.